I'm going to be performing an HEENT assessment on my patient. I've already completed my national patient safety goals and I've already told my patient what I'm going to be doing. So I will start with his head, and I am going to be inspecting and palpating his skull and asking my patient if he has any tenderness. While I am doing so, I'm noting his hair and hair distribution and looking for any bumps or abnormalities on his head. And as I work my way down to his neck, I'm going to be assessing his lymph nodes. He has lymph nodes in front of his ears, behind his ears, under his jaw, and down his neck. And I should not be able to feel his lymph nodes, and he should not have any tenderness for his lymph nodes. If he did, that would be abnormal. Next, I'm going to assess his range of motion. So I'm going to ask my patient to turn his head to both sides, this way and this way, and then also down and up, making sure that he has full range of motion without tenderness. And next, I'll assess his thyroid enlargement. For thyroid enlargement, I should not feel his thyroid. Next, I'll assess cranial nerve 5 by asking my patient to bite down and close his eyes. And then I will assess touch for his face by using a cotton ball and brushing it against his face while his eyes are closed. And my patient would tell me if that was soft or hard. And then I will test cranial nerve 7 by asking my patient to perform different facial expressions such as puffing out his cheeks or smiling. And next, I will assess cranial nerve 11 by having my patient shrug his shoulders against resistance. And I already tested his range of motion, which is by turning his head, and that is also assessing cranial nerve 11. Next, I'm going to inspect his eyes and the area surrounding his eyes, which includes his eyebrows, his eyelashes. I'm noting if he has any drooping of his lids. I am going to retract the lower eyelids to expose the conjunctiva. And I'm also looking for the color of his sclera. It should be white. And noting any inflammation or discharge from his eyes. Next, I will use my pen light to assess his iris and pupils. I will shine my light into each eye, and his pupils should constrict. And next, I will test accommodation. So I will have my patient focus on my pen with just his eyes without moving his head. And as I bring my pen closer, I'm making sure that his eyes are accommodating. So after I've done those things, I can say that and document PERLA, so his pupils are equal, round, reactive to light, and they accommodate. Next, I'm going to check for extraocular eye movements, and I'm going to do that by checking his 6 cardinal fields of gaze. So I'm going to have my patient once again focus on my pen with just his eyes, and to follow my pen with just his eyes without moving his head. So I'm going to go into the 6 fields, and as I'm watching my patient follow my pen, I am looking for smooth, coordinated eye movements. I do not want to see his eyes jerking, which would be nystagmus. And next, I will assess my patient's ears. I'm inspecting for placement. I'm looking for discharge, and I'm also inspecting my patient's nose. His exterior nose is midline, and next I will palpate his ears, noting any tenderness. I'm palpating the tragus and the pinna. And I'm also going to palpate over the mastoid process, which is the bone right behind the ear, and asking my patient if he has any tenderness with that, and he should not. Next, I'll test my patient's hearing by doing the whisper test. And I will stand about an arm's length behind my patient, and I will ask my patient to cover one ear, and I will repeat a series of numbers and or words for my patient to respond back to me. CS7.
CS7.
Can you cover your other ear?
Okay.
RS8.
RS8.
Okay, great. So I whispered those words and he was able to repeat them back to me. He did great with the whisper test. And now I will use an otoscope to inspect his ear canals. I will look inside each ear, and I'm noting that his tympanic membrane is pearly gray. Next, I'll use my pen light to look inside his nares. His nasal mucosa is moist, and there is no discharge coming from his nose. Next, I'll have my patient identify a scent. I have a cotton ball with peppermint on it, and I will have my patient smell what's on my cotton ball, and he will tell me the scent that he smells, and that's testing for cranial nerve 1. Next, as I make my way down to his mouth, I will be assessing his lips, his oral mucosa, his gums, his teeth. He's got all of his teeth, and his mucosa is moist, and I will make sure that my patient can swallow, so they can dry swallow, or I can have my patient take a sip of water to assess his ability to swallow. And that concludes my HEENT assessment of my patient. Before I leave, I will assure my patient's safety and make sure that the bed is in the lowest position, side rails are up, and the call light is